It's 25 minutes before 11 o'clock. Thank you for tuning in. And Robin McLean is here. Adam Mikulin is here. Am I saying your name right, Adam? Mikulin? Okay. Oh, sorry. So you have to put the microphone on. You wouldn't be able to hear you. And just a topic that Robin is going to be... We're really glad Robin is in the studio right now. Dr.
never know.
Dr. Mache Seibel is on the phone. Dr. Seibel serves on the Harvard Medical School faculty. He's the editor of My Menopause magazine. He's a contributor to the Huffington Post, MSNBC. He's been on the Today Show, Robin, which I stood outside of about a month ago waiting for Al Roker to look my way, and he wouldn't look.
Yeah, you did.
He's been on Inside Edition. He's a contributor to PBS. Gosh, it goes on and on and on. He's the founder of the Menopause Breakthrough Action Plan, and he's talking to us about the effects of menopause and early menopause. He's going to talk about that. I don't know that I've ever heard of that before. On women and their families, the effects on both. That's where you and I play a role, Adam, and the family's part of this. Yep. Dr. Mache Seibel, good morning, doctor. How are you?
I'm doing terrific. Nice to join you.
Thank you. Where are you calling from?
I am in Boston, Massachusetts.
Oh, wow. How's the weather today?
Well, it looks like it's going to get worse before it gets better. We're not in Ocala here, you know.
Are you familiar with Ocala? You said it right. Most people who are not from here say it differently, like Ocala or something. Are you familiar with the area?
Well, generally, because I like coming down to Florida. I've actually been there a lot doing talks, in not in Ocala specifically, but in Miami and Fort Lauderdale and in Orlando over the last month or so, talking about my book, The Estrogen Window. So I've been down to Florida quite a bit in the last short while.
I don't know if I'm going to start out on a curveball with my first comment. It's not really a question, but I was watching this thing not that long ago that... scientists have a word for animals that die after their reproductive years are over. And we are not among them. Humans live after their reproductive years are over. And that's what menopause is, right? It's the end of your reproductive years, right?
That's correct. It's just like puberty brings you from pre-reproduction into reproduction. There's a lot of hormonal changes that happen. And menopause takes you beyond reproduction into post-reproduction, and there's also a lot of hormonal changes, and that's what so many of the women experience. And I want to pick up on a comment you made at the beginning about early menopause. I want to explain that a lot of women equate menopause with being older, and it has a kind of a negative connotation.
Right.
But the fact of the matter is that about between 5 and 10% of women go into menopause between the ages, under age 46, in other words, 45 and younger. And 1 in 100 women goes into menopause before age 40. And the symptoms begin up to 10 years before that. So I want to comment that menopause is not about age, it's about transition.
Okay, that's interesting. And the transition is, as you already mentioned, going from being able to reproduce to no longer being able to reproduce. Is there a psychological effect that happens, and is it inevitable?
Well, as I point out in my book, The Estrogen Window, hormones are really a salve for the woman's body. They're not only responsible for the curves in the hips and the development of the breast, but they also allow the brain to function a little bit more facile. In other words, synapses between the brain's neurons go faster so that you're able to think faster, your reflexes are faster, and so forth. It's good for the heart. It prevents plaque buildup in the arteries. It prevents the bones from getting more brittle and keeps calcium in the bones. It helps to maintain the lining of the bladder, keep it stronger so that the woman doesn't have symptoms of a sensitive bladder. It helps to promote libido and intimacy. So it does a lot of good things. And the reason it got such bad press was because of a study that was actually incorrect in 2002 that said estrogen caused breast cancer. And what happened was the study compared women who were largely 60 to 79 years old who got hormones to women who were largely 50 to 59 years old who did not. And the women who had the estrogen who were older actually were many smokers, and many had diabetes, and many had high blood pressure. They're supposed to be well women. whereas the others were not. So the comparison wasn't fair.
But that's the big question. When a woman is going through menopause, she'll go to her gynecologist, and then he will suggest either giving hormone treatments or not of estrogen, and then he leaves that up to the patient to decide if she wants it or not. Is that a good idea?
Well, it's always up to the patient. What a person puts in their body is always up to them, but the facts should be the thing that makes the person's mind up for them. And right now there's a lot of myths, which I call misinformation. In fact, if you're a woman who takes estrogen only, and you take it in the estrogen window, in other words, closer to the time of menopause, you are actually able to lower the risk of breast cancer by 23%, lower the risk of heart disease by 32%, and potentially lower the risk of even mental health, depression, and Alzheimer's disease by a significant amount by taking it early in menopause. So these myths that were perpetuated by the incorrect findings of that study, the Women's Health Initiative study, have caused women a lot of harm. It's really been a shame. And the doctors are also susceptible to this information. And in fact, just a few months ago in the New England Journal, they pointed out that estrogen use is down 80% since 2002. And as a result, the doctors have 80% less experience treating women in menopause or treating with hormones, so they're less experienced. Many are not as knowledgeable as they could be because it's so confusing for people. Because just like in the newspaper, you get the big headline, and then the reprint is that fine print on the inside pages someplace, and all the newer information that's corrected all this has been hidden in the fine print.
So this sounds like something that's not necessarily the fault of the doctors. It sounds like they were just passing on what information was of their day.
That's correct.
Right?
The doctors are doing their very best with the information they have found. That is correct.
So that brings a question to my mind. Let's say a woman 10 years ago was advised not to have estrogen therapy or whatever it's called, and because it might cause cancer. Let's say that was the statement, and she says, "Okay, I'm not going to do it." Now, 10 years later, she hears the new information. What happens if she starts up now? Does everything go back to what it used to? Does she? I don't know. Do her bones get better? Does the estrogen reverse whatever might have happened during the past 10 years?
Well, bones can be treated by more than that one medication, of course, and there are other things that can be done, but the loss of that time is somewhat a detriment. And for that, women have to really be educated now about taking care of the sum of themselves, the SUM of themselves, and not just some of themselves. In other words, hormones. If that's been left out of the equation, she may or may not be a candidate for hormones at this time, because what happens is once that window closes, the risk increase and the benefits decrease. So it's like timing is very important. That's why in my book, The Estrogen Window, is so important to get this message to women. So it's been very interesting, too, because a lot of the women in the talks I've given around the country many of the women will be in their 70s. They've been on estrogen and they've been quite happy with it, but their daughters are now afraid of it, and so they come to hear my talk so they can go and talk to their children who are now reaching menopause and who are frightened, and they want them to get the benefits, and they want to be sure they're right, and they are most of the time.
It is very scary, though, because I know I went through that, and the doctor left it up to me, so I was still confused about it, and I chose not to take it.
Well, a lot of people would, given information that wasn't accurate totally, and that's the tragedy of it all. And for some women, they can continue they can pick up taking hormones, but it's always best if they start sooner. The risks go down, the benefits go up.
Gosh, I wish we had more time for this. The book is called The Estrogen Window, correct?
That's correct.
And how do we get the book?
It's available in bookstores everywhere. They can go to estrogenwindowbook.com. They can get it there, but it's available in bookstores everywhere online. Let's talk further about it another time.
I would love to. Thank you, Doctor, for being on the air with us today. Gosh, I have some more questions, but we can't ask them. All right, thank you. Have a great holiday season. Whatever you celebrate it with gusto. Thank you.
Thank you so much.
Thank you, Doctor. All right, we will take a little break, and we will be right back.
Hi, I'm Seth with AA Lock, Dock, and Security. Have you ever thought about the locks or security on your house or business? Have you ever wondered why the keys to your new car cost so much? Well, at AA Lock, Dock, and Security, we can help with securing your valuables. We can even replace those expensive transponder keys. We can give you the knowledge that no one else will. Call AA Lock, Dock, and Security at 867-1965. That's 867-1965.
Hi, my name is Erica Olstein. I'm a doctor of acupuncture and oriental medicine. Do you have a gout-ridden toe or bowels that move too slow, creaky knees, or how about an asthmatic wheeze? Then acupuncture is sure to please. Come visit me, your primary care physician, Erica Olstein, at A Better You Healthcare. Call me at 352-615-5566. That's 352-615-5566.
FlySanford.com, Orlando Sanford International Airport. We are SFB. Simpler, faster, better.
Visiting friends and family, or just looking for some fun? Book your vacation